My name is Valerie Powell, and I work in the Montrose Cultural Centre, and I'm the custodian crew chief here. When I first started 2 years ago, I was shown the red binder, which is huge, and it contains emergency procedures. And I went home that day and I thought to myself, I'm never going to remember all that. And first of all, to carry this great big binder around in an emergency situation, I thought that's just not going to work well either. So for a while there, I was thinking in my head over and over again, what could we do in the emergency situation? Something very simple. If we could just grab something that had everything in that book, that did all the thinking for us, that would be, to me, that would make more sense. So I did come up with a handbook like this. It sits on the shelf, strategically placed throughout the Montrose building, and it's basically within an arm's reach of, in the situation of an emergency. We could refer to the coding. If it was a code red that was called out, we would grab our book and we would turn to code, the red code, and there it would have everything that we're supposed to do. In simple form, number one, just saying, be calm. And what this book does for us is it does all the thinking for us in these types of situations. It took a while, just because in my head I had a vision in my head, and it just sort of evolved as I worked, probably over 6 months. I would think 6 months to a year before it finally got to where it is. Yeah, I had fun doing it. Very much so, and I had the support of my manager who encouraged me, and that makes a big difference. The action plan booklets, the APB books is what we call them, they have been placed on the custodial carts. We have 2 custodians on site, so in case of an emergency, they just reach for the book on their cart. The library has them in the children's section, on the gallery would have them, Esquires would have them, our tenants all have copies of them, and in the booklet it gives instructions for each tenant what they're supposed to do in these cases of emergencies. I would like to take it one step further and have the color coding embossed on our identification cards, and that way when the code is called, the color code is called, we can at least look on the back and know that we're dealing with a missing child at an Amber Alert, and by the time we reach our APB book, we know already to look under the Amber Alert. It would just make the step that much quicker, faster, and more efficient. I'm going to say that if we give the staff the tools, and they can do their job better and more competently and comfortably. And I wanted to demonstrate that, to our patients, that we work in an organization that is caring and giving, and safety is a huge concern. We want to make sure everybody is safe in an evacuation or an emergency. And to have to go and look for instructions, or like I say, look for the big red binder and then try and remember, oh, what section, what element was that in? I don't know, And then I just thought if we could just simplify everything, just make it so easy. The acronym FEAR, I tell the staff, it has 2 meanings. You can forget everything and run, or you can face everything and rise to the occasion. We have put this to the test a few times in the past couple of years. Just recently we had a power outage. The city was, half the power sporadically was out, the patrons grabbed their action plan booklet, referred to code orange, which is the power outage, and we followed everything the way it was here, and we evacuated within a couple of minutes. Sometimes we have to tweak it a little bit because we're learning from each emergency, each situation, I guess.